All righty, we are live on Facebook and we have a few attendees here in the webinar for the Zoom. Welcome everyone. I'm super excited to be back at the Blue Table Talk. Today I will be joined by Dr. Courtney Walker and Dr. Sheena Gardner. My name is Jordan Graves and I serve as the program manager for the Institute for the Advancement of Minority Health. And on behalf of the Institute, we would like to welcome you all to another Blue Table Talk. We are excited to have everyone join us for the Blue Table Talk. If you have any questions or comments, feel free to share them in the comments section on this post, or you can also, if you're in the Zoom, you can share it in the chat. So to begin, I will introduce Dr. Courtney Walker and Dr. Gardner. Dr. Walker is an assistant professor and clinical psychologist in the Department of Pediatrics at the University of Mississippi Medical Center. She is a co-investigator on Mississippi Thrive and also serves as the co-director for the Mississippi Thrive Fellowship. Dr. Walker obtained her PhD in clinical psychology from Mississippi State University in 2018, following a clinical residency at Louisiana State University Health Sciences Center in New Orleans, Louisiana. Her clinical expertise lies within infant and early childhood development and behavioral health. Her research interests include the examination of parenting practices and adverse childhood experiences on child development and behavioral outcomes. So welcome, Dr. Walker. We are happy to have you.
Thanks for having me.
Next up, we have Dr. Sheena Gardner. She is an assistant research professor at the Social Science Research Center at Mississippi State University. She specializes in qualitative data collection and analysis, management of large administrative databases, evaluation, research design, and manuscript development. Dr. Gardner earned her PhD in sociology from Mississippi State University in 2014, and her research interests center on implementation and the evaluation of systems level change. So thank you both for joining us. We welcome you, Dr. Gardner, as well.
Hey.
So just to get started, can you tell me a little bit about Mississippi Thrive?
All right. Courtney, do you want to go or you want me to go?
It doesn't matter. You can go first, and then I'll chime in.
Yeah. So Mississippi Thrive is a HRSA-funded grant that is a joint effort between Mississippi State and the Medical Center, UMC. And it's focusing on kind of the continuum of care that kids receive in terms of their behavioral health and developmental health. So we're trying to basically create a system in Mississippi that helps identify kids that might have needs, get them the resources they need so that they can be successful in the future, in a nutshell.
Okay, and Dr. Walker, would you like to add to that?
No, I think she summed it up pretty good. We know that, our kids are our future, and this grant really allows us to invest in our young children and try to help them get the best possible start that we can give them. So it's just been a pleasure to work on. So.
Okay, great. So what impact does the environment a child lives in have on their development?
So I feel like depending on who you ask, if it's me or Dr. Gardner, you're going to get two different responses, because I'm a clinician and I typically focus on more of the individual level. And so, I could talk about things related to having a nurturing and loving home environment. So caregivers who are involved with the child, if they are consistent and loving and nurturing and caring, all of that is super, super important for a child's development and just their well-being. But I'm sure if you ask Dr. Gardner, she may have a different response just because she's a sociologist. So Dr. Gardner, what do you think?
So when sociology, it's relatively new for us to focus on kids kind of as their own group. In the past, we've kind of thought about kids as just little people who we have to teach how to be adults. But I think sociology is definitely leaning into some of what psychology does, instead of and looking at kids as like active agents, so that they not only are they impacted by their environment, but they also impact their environment too. So So sociology is going to look a lot more at like system level, so more macro, kind of the 50,000 foot versus the 50 foot, which I think is more what Courtney does. So we're going to be looking at, you know, different systems that may affect kids, rather than just their individual, like what's going on in one kid's life. We're looking at what is going on in their environment, whether that's their neighborhood, the city, the state, the nation that they live in, that'll affect their outcomes.
Okay, so when you say systems, are you looking at the relationships that they're building as children, or would that be more what Dr. Walker looks at, as far as with relationship wise?
I mean, yeah, because there's this idea of, I'm sure most, if you've gone to college, have taken an intro to sociology class, and I know socialization is one of the big things that sociologists talk about. It's basically talking about how you have cultural norms, and that process of instilling those cultural norms into children is kind of what sociology has traditionally talked about in terms of kids. So because you're basing it on what societal standards are, so those are going to vary depending on where you live. It's going to vary the time of, you know, so if you're talking about the 1950s versus 2020, so again, the cultural norms are going to be different. So that's what when I say systems, I think about it wider in that sense.
Okay. And Dr. Walker, would you like to add how relationships affect children's development?
Oh gosh, yes. I could nerd out on this all day. So just from a more of an individual level perspective, like I said, caring, nurturing relationships. It doesn't matter if it's mom, dad, grandma, grandpa, aunt, uncle, doesn't matter, as long as a child has some sort of access to someone who talks to them, reads to them, sings to them, just interacts with them on a daily basis. All of those little interactions, especially for infants, like newborn babies. We know, and brain science tells us that the more a child is interacted with in that way, so talking to, reading to, singing to, the more they're interacted with like that, the better it helps them develop their own brain. And so they have more neuronal connections, which is kind of like a buffer against some of the other stress that life can bring later on down the road. So in my view, relationships, caregiver relationships are essential to child development. And without that, it's kind of really hard for a kid to overcome that. So yeah, I think they're one of the most, probably the most important, if you ask me, for a child's development.
Yes, I completely agree. I took sociology as well my first semester. I loved it. I loved it my first semester at USM, and I loved it so much. I love my professor. She just it makes you think so much more than, and now I'm like, gosh, what did my parents do to me? Did they nature, nurture? I'm like, oh my goodness. So yes, I agree completely. So my next question is, what is behavioral health? And either one of you can answer this, but how it also relates to childhood experiences.
I'm gonna let Courtney have that one.
Okay. So behavioral health really just it's kind of like another term for mental health or mental well-being. So when we're talking about children, a lot of the times that they tell us or show us that they're having difficulty with mental health problems, whether that's anxiety, depression, aggression, something like that, it usually presents as behavior. So with young children, say, for example, who have experienced something really scary or traumatic, a lot of the times we'll see that they're a little bit more hyperactive, they tend to be a little bit more on edge, or they may act out aggressively towards other children, but that's all in response to something that really scary happened to them, because they may not have the words quite yet to describe or explain or process what happened. So there is adult behavioral health as well, but I won't talk about that. But generally, it just means it's another term for mental health. And we kind of think it's a little bit more, maybe like less stigmatizing than saying mental health, because there's a lot of things behaviorally that you can do to enhance or, improve your mental well-being. And that's generally why we call it that. But it's just another word for mental health too.
Okay, cool. I did not
Yeah.
know that. I learn something new every day.
Yeah.
All right, so Dr. Gardner, you have a background in sociology. Can you talk a little bit about sociology and how it relates to child development?
Yeah, I mean, I touched on it a little bit a little while ago. Um, Again, I think talking about children as a group is relatively new in the history of sociology. And actually, to be honest, this is kind of my first foray into looking at children at this age group. I have traditionally worked not directly with kids, but with the age groups that are a little bit older with work related to the justice system. So I'm actually learning a lot along the way as well. But again, sociology is focused more on socialization, trying to get those cultural norms kind of, indoctrinate is such a terrible word to use. I can't think of a better one, but kind of instilling those cultural values, because we want all kids to grow up to be functioning members of society. They need to know how to act and fit in. But again, like we're saying, our ideas of who children are or what they mean to society changes over time. So, for instance, there used to be a point in time where there was no such thing as child labor laws. So, with our understanding of what kids mean to us as people in our society, we decided that that's actually not something that we want to do to kids, is have their little tiny baby hands working on things that are intricate and detailed that little hands are needed for. So just things like that, because that's kind of the slant that sociology would take.
Okay, thank you so much for elaborating on that. And society is always changing, so it's so crazy to develop social norms, and it's so much changing. I know from when I was growing up compared to now, we see a lot of difference in changing, and of course, like social media, things like that are changing how people view society and things that we consider social normals now. So, all right, my next question is for Dr. Walker. Can you discuss different parenting practices?
Oh gosh, I feel like I might get some flack for this, but yes. So kind of going along with what Dr. Gardner was saying in terms of how social norms change what we know about kids and what we know what is best for kids. The past, I would say, well, a good chunk. We've actually been studying this for a little while in terms of what parenting practices are the best for outcomes. And sometimes that looks different than what has traditionally been done. And so a lot of the work that I try to do as just a clinician is to kind of help parents and help caregivers know, like, hey, we've studied this and we know that if you try this over this, that actually can help improve your child's emotional well-being and makes them less at risk for other things down the road as they age. And sometimes that's hard for parents and caregivers to hear, because that was so different. It's so different from what was done to them and what was done to their grandparents. And generally, parenting is a very culturally, it's culturally based. So we parent on how we were parented generally. So I will say this has, our knowledge of what is best in terms of parenting practices has changed given how long we've studied it. But in general, there are 4 different parenting styles, you could say, that parents typically use with kids. The first style is the kind of the best, or what we know is related to better outcomes for kids, and it's called authoritative. So not authoritarian, but authoritative. And so that's really, those are parents who set rules and set boundaries, and they're consistent boundaries, but they also have a lot of warmth and nurturing in their parenting. So basically what research shows is that, yes, you have to have some boundaries with your kids. They can't just do much of anything, but you also need to meet with them lots of warmth and lots of nurturing and lots of care to balance out the kind of the rules and the boundaries and things like that, because kids need both. Another style that's typically not as associated with good child outcomes is called authoritarian. So typically those parents typically involved in more discipline strategies, and they tend to be a little bit harsher too. and they don't really have a lot of that warmth and nurturing kind of parenting practice. It's more just do as I say, when I say it, and I don't need to tell you I love you because you should know that already. So that one's not as associated with good outcomes and actually places kids more at risk for things like psychopathology as they age. Another style is neglectful, and that's just what it sounds like. They don't really provide care or discipline. They just don't really provide a lot of parenting at all, and that's not good for kids. And then the last is more permissive. So these are parents who typically just kind of let their kids free range. They don't really have a lot of rules. They have a lot of warmth and love, but they don't put a lot of rules and boundaries in place. And so that's not typically associated with good outcomes, but it's not as bad as, say, authoritarian parenting. So.
Okay, and do you see one more than the other? Just like being in the southern region, is there one that's more, I guess, more common?
Yeah. So we typically we see a little bit more authoritarian parenting. And, you know, I'm from the South. I'm from, you know, Mississippi, so I can't say anything. But typically we see a little bit more authoritarian parenting here. And the cool thing is, or the interesting thing is, typically elsewhere, dads are more of the authoritarian parent, but in the South, especially in Mississippi, it's more of the moms who tend to have that more parenting role. And I don't know if any of the listeners have that experience, but for some people, moms are like you do not cross mama, you do not do, like, she is the disciplinarian in our household, what she says goes. And so we kind of see a little bit of an inverse kind of compared to other parts of the country where moms tend to be a little bit more authoritarian than dads. So.
That's crazy, because just growing up and seeing friendships, I kind of, once you say it now, I see both. And so I've seen the mom be the authoritarian, and I've seen the dad, and I've seen how that works. But I also, once you said authoritarian was more common in the South, I figured it was. I was just wondering because I just know how we are down here, and you don't question mom and dad. You just listen to what they say. So that's really cool. Okay, thank you. So my question now is, how can parents track their child's development? I know that's like a very broad topic, but just kind of, I guess, because of one, you're looking at the relationships, you're looking at sociology as well, but how can you track that, you know, your child you're doing right, basically? Whoever wants to go.
Oh, well, I mean, I can go off of what I know from working on this project. You know, there's several tools and strategies that you can use to track your children's health. They have developmental milestone checklists, so kind of giving you an estimate of what behaviors and activities a kid should be doing by a certain age. So whether by, I don't know them, so by month 2, they should be able to hold their head up, right? So I don't have any kids, but so it kind of gives you an idea of where they are, so that if, say, they're not speaking by a certain age, that might be indication to you that you might need to go talk to somebody about getting them screened to see if they have issues, like maybe they have a hearing issue that you don't know about that's affecting their speech or something like that. There's also actual evidence-based screeners that you can do as well. Some can be done by the parent, others are done by a clinician like Courtney. And so those are evidence-based, like I said. So based on what the results of that are, that can give you an indication whether, you know, the child's okay. Maybe you just need to watch out to see if they're still developing okay versus them needing some therapies of some kind. Yeah. Courtney can probably elaborate more in depth on the different types of screeners and assessments that are used, but I think that's the limit of my knowledge there.
Yeah. So yeah, everything that she said, yes, is accurate. That's how we track child's development. And we actually, you know, I think a lot of parents get a little nervous when they start to kind of wonder, oh, is my child doing what they're supposed to do? And there's a lot of anxiety in that because you feel responsible for this child's development. And if they're not developing in a certain way, is that because of something that I did or what did I do? But I want to preface it by, children do have a range of what is typical development. Just because Johnny started talking at 10 months doesn't mean it's abnormal if Billy starts talking, I don't know, I make up really silly names, I'm so sorry, at 12 months. That's still normal, and that's within the range of normality for kids. So I do want to preface that kids do have their own trajectory, and they do meet milestones at different times, and there's a lot of range in terms of what we expect to be normal. But the evidence-based screeners that Dr. Gardner mentioned are what we call the gold standard. And the reason why is because they have, they really compare to other kids their exact same age, right? So they know based on this kid's age and where they are in life, they should somewhere be in this range, versus just kind of eyeballing it and saying it and Googling, oh, well, my child is, they're lifting their head and they're doing stuff like that. So it's a little bit more in depth, and that's why we typically recommend those evidence-based screeners. And that's something that parents can ask their pediatrician for at their well baby visits, and it's actually encouraged by the AAP that they do those. So that's definitely something that they can ask about in those well baby visits, especially if they're worried about it. There's also, like say a child does come up at risk or something on a screening tool, that doesn't necessarily mean something is wrong. It just means that we need to take a closer look at it. And so we'll typically refer for an assessment at that point, and they'll see a specialist, and they can kind of figure out, is this really something that we should be worried about, or can we manage this at home? But it helps us get that child on the right path. And generally, I'm really kind of conservative when it comes to early intervention. I think all kids could benefit from early intervention. Well, not conservative, I'm liberal in that regard. That was a completely wrong term. Every kid could benefit from early intervention if I had my way, but I don't. So just because your child may need speech or physical therapy or occupational therapy doesn't mean something's necessarily wrong with them. It just helps them get back on track. And those interventions can be helpful, very, very helpful later on down the road too. So.
Okay, and
side note.
Oh, go ahead.
He said something that reminded me about, kids develop within a range. So I have a twin brother, and I developed a lot faster than he did. So my mom always knew when he would start crawling and walking and talking, because it always happened like 6 to 8 weeks after I did it. And so at first she was nervous because my older sister, was a very quick developer. I was behind her, and my brother was even further behind us. But that just goes to show he's fine now. There's nothing wrong with him. But that just goes to show that kids born at the same time to the same mother, the same parent, there's a wide range in how quickly they get a handle on things.
Okay, so parents don't need to be alarmed. That's the major thing. They don't need to be alarmed if the child may not be developing at the rate that they are used to, or their sibling might have. They should just look at possibly doing early interventions. And Dr. Walker, could you just elaborate a little bit about early interventions, just for those who are listening, just to understand what they could do?
Sure. So early interventions are typically speech therapy, occupational therapy, or physical therapy, and those are typically indicated when we've said, okay, your baby is just a little bit behind where we want them to be, so we need to get them caught up. And so it would be like a weekly or bi-weekly session that you would meet with the therapist, and they would work with the baby or the toddler and just help them get on that right track. And a lot of the times therapists will teach parents or caregivers things to do at home to also help with those milestones, because honestly, if you think about it, they only see them like once a week for like 30 minutes. And so really the parent is encouraged to become the therapist in the sense to help their child develop and get as much practice as possible. Now, there was something else I was going to say, but it's gone. Oh my gosh. You asked about early interventions, and now it's gone. It might come back to me.
It might come back. No, it might come back. But so now I'm thinking, this is kind of a question that I have. I know with COVID going on, a lot of my children are stuck either in the house or they're not necessarily interacting with people like normal, interacting with children their own age. Have you all seen any changes as far as with development, or have you all noticed parents seem to be more concerned about their child's development now that they're stuck kind of in a closer environment?
That's a great question. And yes, I have seen in terms of more social emotional development, there have been a little bit more concerns in those areas. And that can look like just not really interested in playing with other kids, or they may have sort of not so good behaviors when they do go in public. So maybe being a little aggressive or having super extreme temper tantrums. And so generally, if I rule out other things and there's nothing else going on, I'll typically recommend enroll them in school, enroll them in some kind of like Mother's Day out, get them talking and interacting with other kids their same age. But in the COVID era, whenever I suggest that, parents are like, but COVID. I'm like, I know. So I remember what I was going to say. So there is, if parents are interested in trying to find kind of workarounds for things like that, there are these wonderful apps and websites out there that are available to parents for free if they just want to get ideas about how to enhance their child's development, whether that's socially or their speech or language or whatever. It's available to them. And one of the ones that I like is called Vroom. That's V as in Victor, ROOM. And it'll send you like a daily text about, hey, try this with your baby today, and that will help with blank. And so you can get ideas, and you kind of have just to get creative in this era to get your kid that exposure. But yeah, I have seen it's difficult. I mean, it's difficult on kids. It's difficult on all of us. So why would it not be difficult on them too? So.
All right, yeah. Dr. Gardner, did you want to add anything?
I don't think, to elaborate more on that app that Dr. Walker, was mentioning. What's cool about that app too is that it's age specific. So when you go download it, and you actually create a profile for your child. So you put in when they were born, and they make sure that whatever they send is appropriate for that age. So they're not going to send an activity for a 5-month-old that they would send for a 4-year-old. So that's something that's really cool about it. So you don't have to worry about doing any weeding out in terms of making sure that it's a good fit.
Okay, and that kind of goes into my next question. What resources does Mississippi Thrive provide to help parents with child development?
Well, we've got a website that has a lot of information. One of the things that we're particularly proud of is a resource map that is available. And so it lists, there's lots of categories. Courtney will have to help me. It's pediatricians, allied health, so that's the speech therapist and occupational therapist. Is daycare provider still on there? Or I know it was at one point. They might have taken it off. It is.
Yep. They're licensed child care centers.
Right. So there's, that type of information. We also provide links to other organizations like CDC. They spend a lot of time and money on developing materials. So we link people to that type of thing as well. And also to some Mississippi organizations that are child focused.
Yes, and so if you just want to go to Mississippi, it has to be spelled out, thrive.com. There's a tab that says resources, and there's other things that you guys can see too. But that resource map that Dr. Gardner was talking about, it's really helpful, especially if you live in I grew up in the country, so there wasn't much around us. So it helps you figure out who that specialist is remotely in your area. And, teachers can use it, parents can use it, providers can use it, just to kind of get a feel of the lay of the land in terms of early child care or early childhood stuff. The other thing, it does have links to other groups in Mississippi, like Dr. Gardner was saying. So Help Me Grow Mississippi and Excel by 5, and Help Me Grow Mississippi actually has a phone number that parents can call. I think it's 8 to 5, Monday through Friday, if they are looking for a particular service, and Help Me Grow can kind of help them connect to that too. So that's listed on our website as well.
Yeah, and Help Me Grow is not just child-related things. It's also, you know, if a family might be having issues with other aspects of their life, like economic issues, they may be having food security issues. So it's they can link you up to a lot of different resources there at Help Me Grow.
Okay, great. And I see Tiara had included some of the, she put child for the resource guide. She was saying child care providers, health professionals, teachers are the 3 sections on the website for parents to utilize. So that's what she was saying. And you, Dr. Walker, has shared the Mississippi Thrive link, which I can share and comment after as well. So I'm gonna check in Facebook to make sure we don't have any questions. I do have someone that was asking about nature versus nurture. This is kind of whoever wants to take this question. They were just asking, I guess. And then I have another question that says, how early can you know if a child has dyslexia or reading disability? So these are 2 questions, either one of you can answer.
Okay, I'll take the nature versus nurture question. Clearly.
Okay.
But again, this is a topic that's often discussed in intro to sociology level classes. So it's this idea that you're born, you are who you are, there's no changing anything about it. That's nature. And then the flip side of that is nurture, basically saying that you become who you are because somebody has brought you along the way to become that person. Obviously, it's a mixture of the two. It's not one versus the other. In situations, and Dr. Walker can speak to this, where there's actual biological reason why a child might be having a delay, then that is definitely an example of nature. There's only so much you can do if you have an actual medical condition. But on the flip side, the nurture side, this is where you start talking about what are the parents doing, you know, with the kids, or other care providers doing with the kids. You know, if you want to look at it on a more societal level, how is Mississippi, for example, investing in children? You know, you could talk about things like Medicaid expansion, like doing something like that has an effect on kids, and that's not something that kids have control over, but it is something that would nurture them in a positive way towards positive outcomes. So it's a mixture of the two, and it will differ for individual kids.
Yeah. And I'll just add on to that too. Even for kids who have maybe like a medical or kind of biological reason for a developmental delay, there is a huge difference between kids. So nurture still comes into play for them. So I have seen huge differences between kids who do have those conditions and don't get those early interventions and don't get into school, and they just don't engage with those resources. There's a huge difference between kids who do and do not. And even for those kids who are maybe biologically predisposed to have some kind of delay. So it's important for them too. So environment, a lot of our systems, whether it's parent or more of at the macro level, like Dr. Gardner was talking about in terms of our Medicaid and state-funded pre-K and child care centers and things like that, all of those things are so very important to child development. I can take the dyslexia question. This is a great question, and I think it's something that a lot of parents are worried about, because I feel like dyslexia is just like I don't know, I feel like it's thrown out there a lot as a term. Generally, we don't go towards a diagnosis of a reading disability or dyslexia until the child has demonstrated some sort of impairment in school performance, right? So until they are required to start meeting a certain standard in school, it's really kind of hard for us to establish this impairment kind of classification and making the diagnosis. But I will say there are many children who maybe are born premature and they have a speech language delay, and you can have speech language delays in infancy and toddlerhood, and those things make a child way more at risk for reading disabilities and other learning disabilities as well. So I'm not saying that it may not be there. It may not be there in the terms of impairment, but there's definitely things that happen very, very early. And if you don't get intervention, it places that child at risk for a reading disability or dyslexia once they enter school. And a lot of those demands are starting to be put on them. So like, you know, a 4-year-old, for example, isn't quite expected to read and get mastery in certain things, especially if they're in like a pre-K4 program. So they may not have that impairment yet, but if they have those risk factors, like I said, of prematurity, speech language delay, hearing impairment, things like that, that can place them more at risk for a reading disability. So it's a great question. And if you're worried about speech language development, that can be they're talking late, or they're not quite using sentences, or something like that. Bring that up with your child's pediatrician, and they can do a screener and see if therapy may be indicated for that child.
Okay, and I have a question. Is there a screening for autism? It is. I know autism has become a growing topic. I know because of a lot of vaccine information, and people are like, oh, vaccines cause autism and all that. And so I was just wondering if there's a screening, or are there early signs that parents can look for as far as if their child is development or has autism?
Yes. And let me first say that autism is not connected to vaccines whatsoever. There unfortunately was a paper published a long time ago where the author unfortunately made up his data that showed a connection between autism and vaccines, and since then that paper has been pulled from the literature because he committed fraud, which is not good. So unfortunately, that kind of set this foundation for a lot of myths and just not trusting vaccines. But there is no connection between autism and vaccines. You may see that the rates of autism have increased over the past few years, but really most people think that that's more related to our ability to detect it very, very early. And so that's one of the things that I do as a clinician. And you can start to see some of these things very, very early in infancy, because children as early as 6 months are communicating with us socially. They don't have words, but they're using eye contact. They're using facial expressions. They can look and see what we're looking at. They have this really nice back and forth play with us, and it's super cute. Just because your baby's not doing that doesn't mean they have autism, but sometimes you can start to see those signs very, very early. But typically we start screening for autism around 18 months of age. We use what is called the modified checklist for autism in toddlers, the MCHAT. It's a really common tool. You can find it on the internet. It's free to use. But again, that's a screener. So that just helps us figure out, do we need to look further into this to see if this child may be at risk for autism? And I will say, I work with children on the spectrum all the time, and they are such wonderful kiddos, and they're all so very different, which hence the term spectrum. But in general, if your child has autism, that's not bad. That's not anything that we need to get an intervention, but it's not bad. These children are wonderful, and they have their own personalities and their own likes and dislikes, and they just have a different developmental trajectory. But early intervention for them is very, very, very important. And so the earlier we can identify and diagnose, usually, hopefully, by age 2, we can do some really intensive intervention. So by age 5, things are going to look very, very different for that child. So, yeah.
Awesome. Thank you so much. That was so helpful, because I think a lot of people hear so many things regarding autism and don't really know what's the connection, and a lot of people think, oh, it's the vaccines and all that. So I just want to ask, it was just my own personal question. But
No,
I
it's a good
appreciate
one.
you all
It's a
so
good
much.
one.
I don't have any children, but when I do, I'm like, look, I need y'all to look at this, look at them and tell me what's going on with it. But no, thank you all so much for answering those questions. I'm not seeing any more at the time. But I really do appreciate you all taking time out and just to talk with us. I've learned so much. I know our listeners have learned so much as well. We have people who are sitting on the Zoom, and we have people on Facebook commenting. So, and a lot of people are saying how they never heard these things before. So it's wonderful that you all have shared this information, and we'll keep it. It's still on our Facebook. It'll still be up for people to watch. And if they have questions, we'll definitely let you all know. But we really, really appreciate you all for taking time out to do this with us. I enjoyed it. I know everyone else did. If I will share, I think Heather Martin actually commented the room link already on the Facebook page, and so, but I'll still list any resources. I'll list your page as well, your web page that you shared with us, so everyone can be connected to those resources that you all have. Did you all have any other comments or questions or anything else?
I will just say I misspoke. We can start using the MChat at 16 months, not 18 months. So I wanted to clarify that.
All right, thank you so much. Any other comments, Dr. Gardner?
No, I think that's it.
Okay, well, I appreciate you all on behalf of the Institute for the Advancement of Minority Health. We thank you all for joining us, and we thank you, Dr. Gardner and Dr. Walker, for joining us today. Hopefully we can do another one because this was so helpful and it was so informative, and I know a lot of people will go back and listen because it has some great information. So thank you all again, and I hope everyone has a great evening. Bye-bye.
All right, bye, y'all.
Bye.